Proton therapy is a form of particle beam radiation used to treat localized tumors with high precision. The system delivers charged protons that deposit energy at a controlled depth, minimizing exposure to surrounding healthy tissue. The ProBeam system was developed by Varian Medical Systems in Palo Alto, California. It was released in 2011 and received FDA Class II clearance under 510K, K1223. The system uses high-energy protons to target tumors while reducing dose to adjacent organs. The proton therapy system includes three functional subsystems. First, the acceleration and beam control unit uses a cyclotron or synchrotron with steel and copper magnets to accelerate protons. A stainless steel beam transport line guides the beam to the treatment room. Second, the delivery and modulation unit includes a 360-degree rotating gantry and a carbon fiber brass nozzle that shapes and modulates the beam. Third, the positioning and safety unit features a radiolucent carbon fiber patient couch and a control console for alignment and monitoring. The gantry height reaches 8.2 feet from the floor to the top nozzle. The base width of the machine is 3.5 feet. A person standing next to the system measures approximately 5.5 feet, providing scale for the equipment's vertical clearance and footprint. Protons deposit most of their energy near the end of their path, forming a sharp peak known as the Bragg peak. This peak aligns with the tumor region, allowing maximum dose delivery at the target site. Beam energy is modulated to spread the Bragg peak across the tumor depth, forming a spread-out Bragg peak. Adjusting proton energy controls the depth of penetration, with higher energy reaching deeper tissues. Minimal exit dose reduces exposure to healthy structures beyond the tumor. Beam energy is adjusted using degraders or extraction control. A range modulator wheel spreads Bragg peaks to match tumor volume. Scanning magnets direct the beam across the treatment field. A feedback system monitors dose delivery in real time, ensuring accurate modulation and alignment. Proton therapy is used to treat localized solid tumors. Common sites include the brain, spine, prostate, lung, head and neck, and pediatric regions. Pediatric applications benefit from reduced radiation exposure to developing tissues. Organ protection includes preservation of the heart, optic nerves, and spinal cord. Proton therapy regarding brain tumors protects optic nerves and healthy brain tissue. In cases of spinal tumors, proton therapy minimizes the dose to the spinal cord while targeting vertebral lesions. It also reduces cardiac and healthy lung exposure compared to X-rays. For prostate cancer, it limits radiation to the bladder and rectum, reducing complications, and for head and neck tumors, it preserves salivary glands and oral structures. Children's rapidly dividing cells are highly radiosensitive. Proton therapy uses the Bragg peak to deliver targeted dosing with minimal exit radiation. It is commonly used for pediatric brain, spinal, and abdominal tumors. Long-term benefits include reduced risk of developmental impairment and secondary malignancies. Proton therapy requires high infrastructure investment, including cyclotrons and shielding facilities. Accessibility is limited due to capital and maintenance costs. Tissue heterogeneity affects beam range precision. Organ motion during treatment can shift the target zone, impacting dose accuracy.